It would be an emergency and somebody would come in. Oh my God. Oh, jeez.
Today is Thursday, June 3rd, and it again is another exciting day at FenVet. I think each and every day is, but each day brings us something new. Starting off, we did a small dog spay and then flipped into 2 large dog neuters. The neuter that we did was still pretty routine despite it being quite a large dog.
Big dogs grow at a slower rate, and when we neuter them, it gets rid of that hormone, which closes their growth plate sooner. So there's been some theories and studies that if you neuter them sooner can lead to early onset of degenerative joint disease and arthritis in big dogs. Some people wait to alter them for that reason. I think they're just doing them just because it's fine to do them anytime after 6 months.
And I do nothing. We do have a student with us. I was able to explain to her that you have to be pretty aggressive with your castrations on big dogs because the tissue is just that much harder to tear. You ready?
Yeah.
All right. So we always do I always do pre-scrotal, so
Okay.
push it up, hold, just make an incision along there. It starts to pop out. I always try to do closed because there's less of a risk for herniation after. And you have to be so much more aggressive than you think for closed.
Compared to the cat?
Yeah, like you have to, like, I feel like I'm doing like a horse neuter. Like that took some strength to actually pull it. So
Horse neuter.
a horse castration.
So I tried them.
These owners also want to keep the testicles. Yes. So they just said they have a bottle of formaldehyde at home, so they want to keep it.
Is that like a 1 in 100? Or?
I have never heard anyone ask to keep them before. So, yes, definitely
Not common.
not common. Then I just push the other one up.
They're the same.
Yeah,
Okay.
sorry, through the same. And do the exact same thing.
You're a good TV personality.
I'm good at making fun of myself. Okay, and then I just close everything. You can see, like, you want to close all 3 of those. It's actually nicer when they're bigger because there's a little bit more tissue to close. There we go. Done. Easy peasy. Easy peasy. Everything went really smooth with our neuter. Then we flipped into an amputation on a kitten. This kitten has a spiral fracture of its tibia. The referral center had recommended the gold standard option, which would be pinning it, pinning the bone, going to surgery. The owner was really concerned about the recovery of the leg afterwards, as well as the cost of pinning it. So she called us and asked for some other options. We discussed potentially splinting the leg, which she has the splint on now. The issue with the splints though is kittens are pretty wild and like to run around, so she's having a really hard time keeping her quiet and contained, and doesn't think that she's gonna be able to manage the splint for the period of time needed for it to heal. So instead, we're going to amputate the leg, which because it's because it's a back leg, she'll do really well. Her recovery time will be significantly less. She'll probably be back to herself within 2 weeks. I think it always surprises people when we say we should go to amputation. It's just that part of it is that we can't tell animals that they need to stay quiet and heal.
It's a big decision to decide to remove a limb off your beloved critter. Like, that's not taken lightly at all, right? And you feel like a bad owner to be like, yes, remove my cat's leg. It's a really big deal, but dealing with the splint for 6 to 8 weeks is very difficult for lots of people. So, like, this is not a bad option.
The break is in the tibia, I believe. It's
Yeah.
right here, the bone right here, just below the knee.
Maybe we could put a sterile glove over the leg.
So
And
you
then I'm gonna
can't-
get Paige to hold it up and she'll manipulate it for me, so it will be a little bit more awkward just because I'm used to like moving it where I need to go to be able to see things. Just I figured the glove, at least you can stay sterile a little bit. And what we're gonna do is we're gonna try to pass the leg through the drain. Yep, keep going, yep. So we'll just get you to kind of hold that all together like that, and just make sure you hold the bottom, just so that it doesn't drag in anything, and we'll get this off. You can feel the whole femur here, so if you want to palpate, like you can feel the tiny little chicken bone. So we're gonna go about a third up distally around, and then we're gonna pull the skin back. Usually go a little bit, leave a little bit more skin up medially, so we have a little bit more to flop over. Okay, so that's what we did, which is nice. If they're not twitching a ton, that's good, because it means that it should be blocked pretty good. There is a big vessel on this side. There, you want to pull it that way a little bit, and then you'll see a little bit better. Let's see that like really white thing.
With the fire
That's a nerve. We do want to clamp that, and you want to tie it. So now we're all down to the bone. So then I will take this muscle off and peel it back some so that I have muscle to be able to cover my stump. This is called giggly wire or OB wire. We use it in lots of like cattle procedures, like obstetrics. So yeah, and like dehorning and stuff. You can get a bone saw, which would be great, but they're expensive. So for the amount of amputations that we do right now, it's not really worth it. And then you can get bone cutters. We just, WD's, like the ordering service, had 0 bone cutters. So we decided to kind of do what we could and went with wire. Now that we have the leg off, which is nice, leg gone, we're going to just smooth out this bone. Rasp this and make it nice and smooth. But it's like nice and smooth, so no pointy pieces, nothing that's gonna stick out.
Yeah.
Should be like nice to close the muscle over that. And then we're just gonna close all the muscles together and close the skin. And
Like, what would have happened if she had just been left to her own devices, or?
the leg like being broken,
Mm-hmm.
it probably would have, one might have healed, but healed abnormally. So she would have had like abnormal conformation the rest of her life, and potential like struggled with arthritis and secondary complications. The other thing could have been it would have broke worse, made things worse, or it could have even got to the point where she just stopped using the leg. Then she gets severe disuse atrophy. If she stops feeling it, she might start chewing it off. Like, there's quite a few secondary complications that can happen. Sometimes they will like eat the leg, or if it's really painful, they'll gnaw at it, or risk of infection if the bone is dead. Can you think of anything else, Paige?
No, those are the same ones I was thinking of.
Well, I bet by next week she's trying to run around like nothing happened. There.
Good.
Oh, what did you do?
No,
It was the other leg.
no, it wasn't.
The kitten is now on a hydroketamine CRI. So this is a continuous rate infusion. So she'll have continuous pain meds for the next probably 6 hours. Then we'll wean her off and send her home with some really good anti-inflammatories and opioids to help control her pain over the weekend. She still will have to rest for quite a while, but I suspect within a week and a half, she'll be back to her normal self again. The stitches will be removed in 2 weeks, and now she just has to slowly recover, but because she's a kitten, she'll bounce back pretty fast.